Hi, this is Dr. Baruti from Get Well Urgent Care. We are here for another medical minute. This is our in-service on back pain as it refers to fractures and osteoporosis. This is our staff here, our physician assistant, Carla Jones here, and our very sharp MA team here, Paige, Angela, and Rita here, and our executive vice president, Marissa. She's here to keep us all in line. So this is just for about 5 or 6 minutes, so don't stop the video early. So today we saw a patient, 69-year-old Caucasian female, who came in with back pain for about 6 weeks. She had gone to her primary care doctor and they gave her some Mobic and some Ultram to take, but that didn't help her pain. And so she came here for urgent care. So the reason why we're talking about back pain in the urgent care setting is because that is a very common cause for people to seek urgent care. Okay, upper respiratory tract infections are number one. Sore throat, sinusitis, bronchitis lower, but and then you'll have headaches, then you have back pain. So if you work in an urgent care environment or ER, you're going to see patients with back pain. Sometimes the back pain can represent fractures in the vertebrae. Remember, the vertebrae is a column of bones, okay? 33 bones in the back. These are the vertebrae. In between are your vertebral cartilages or your intervertebral disc, okay? So when a woman is above the age of 51, which is the average age that a woman goes into menopause in North America. Remember, menopause, the absence of estrogen, progesterone from the ovaries. A lot of things start to happen to her bodies. Now, nobody here is 51. Almost. Okay, I'm sorry. But at 51, that's the average age. So some women will have it at 48, 49, some 54. Our patient this morning was 69, and she hadn't had a period in, 15, 16 years or something like that. Okay, so she was having back pain, lower back pain in the lumbar area. And so what happens when a woman stops making estrogen? There are two types of cells that live within the bony matrix. When I say bony matrix, look at this here. This is the bony matrix. This is healthy bone. This is what a bone looks like. It's like a forest of calcium phosphate. This is a healthy bone. This is bone with osteoporosis, okay? Lots of holes in the bone, it's weaker. So what causes a woman to go from healthy bone to osteoporosis? Well, this is what we'll talk about here now. So estrogen. Estrogen is a hormone, a little tiny hormone that's made in the ovaries, okay? And estrogen does a lot of things for a woman's body. It makes the woman, feel woman, nice, smooth skin, soft hair, makes her body shape a certain way. It makes her bones strong. How does estrogen make a woman's bones strong? Well, there are two types of cells that live in the bony matrix, okay? And one type is called, does anyone know? This is an osteoclast. That was Paige who said that. Look at Paige. So an osteoclast, these are bones that resemble like Pac-Man. They eat the bone, they eat the calcium and phosphate, releasing calcium in the blood. So they tear down bone, okay? And the other type of bone cell that lives inside the bone is osteoblast. Again, that was Paige. Okay, osteoblast. Blast, they lay down bony matrix. So you always have osteoclast and osteoblast laying down bone. So bone is living, okay? Well, estrogen, when estrogen gets to an osteoclast, it has a receptor inside of the osteoclast that makes that cell undergo programmed cell death. That's called apoptosis, okay? So apoptosis, the osteoclasts, they die, they self-destruct when estrogen binds to its receptor on the inside. So you have very few osteoclasts, and you have an overwhelming proportion of osteoblasts. So the woman's bone stays strong as long as she's making estrogen. You can open that door. As long as she's making estrogen. Well, at 51, no more estrogen. She's 69, so she's been in a state of low estrogen, and she doesn't take estrogen, so she has thin bones. We didn't do a bone density on her. We just looked at her, and we said, okay, her age. She belongs to she's Caucasian, so she has more of a risk for osteoporosis. So what we did today, we ordered an x-ray of her lumbar spine. And we told her, you probably have what's called a compression fracture. Yes, we know this is regular back pain. Lots of people have back pain. But for her demographics, she is having, most likely, a compression fracture here of her vertebral body, because it's not a lot of bony structure to help her bones stay strong. And she can just walk around and her vertebral body will crush like a styrofoam cup. You set it on the table, you crush it. That's a compression fracture or a crush fracture. So we got an x-ray this morning, and the x-ray came back. She had a compression fracture of the 4th lumbar vertebrae. And the radiologist noted that it seemed to be an acute fracture. So acute is less than how many weeks?
6 weeks.
6 weeks. If it's more than 6 weeks, it's chronic, okay? And so we set her up with an appointment with who?
Surgeons.
Okay, so she has an appointment to see an orthopedic surgeon. Because when your patients in the urgent care setting have a fracture, the urgent care should acknowledge that they need a higher level of care, okay? And so even though I may think there's not much that can be done for a mild compression fracture, she still needs an orthopedic surgeon to tell her that, or to manage her in ways that they know how to manage that is outside of our scope, okay? And so the lessons for today is that when a patient has back pain, a lot of people will present like that, but you have to